tell me one part of the brain and what it does? Aya.
Cerebellum keeps it balanced.
Okay, so cerebellum helps to keep you balanced. Pain is a protector.
Pain in children is often misunderstood as well as misrepresented. People sort of don't think it exists, but 1 in 5 children have chronic pain.
Chronic pain is a very, very burdensome challenge for our society. Largely, it goes unspoken.
I'm studying pain science in schools. So what that means is, how do we implement the science of pain into the curriculum and into the culture of schools? I noticed that teachers were doing a lot to help kids, but they just didn't know how. And I really felt the need to link health and schools, because if we share that responsibility, it's going to be better for everybody. We started with schools in New South Wales and Queensland and implemented teacher-led pain science.
So memory really has a big influence on the way that we feel pain and we assess pain.
If we have one focus, it is to prepare students for life. Being healthy and looking after yourself as best you can is so important. And we like to see that knowledge that they've gained in the classroom then comes out onto the playground or into their lives.
There's an actual science about how the body and the mind connect. So you can feel things in your body, and it may not necessarily mean there is physical injury or damage in the body, but it doesn't mean that it's not real. So having a shared understanding across health professionals and school and their personnel really helps to validate children's pain, which then in turn helps to reduce the problem of stigma. And then that in turn helps to reduce the pain itself.
Something that's unique about Beck's work is that rather than clinicians saying, well, we do patient education all the time, so we can educate people in schools, this kind of flipped that model and said, like, how does an educator who's already looking after the well-being of the kids in their class, how do they approach it? And what we found is they naturally fitted into their curriculum.
Josh and Beck came and did a couple of days training with us, and then I wrote a program for years 3 to 6. We're understanding how to regulate ourselves, how to be resilient. That's all part of the syllabus for health, so it fitted really well into our health program. A child's health, if they come to school anxious or sore or in pain, that's definitely going to affect their learning, and if we can learn to deal with that and help them through that, you're giving them strategies not just to help them through their day, but to help them for the rest of their life as well.
What we learn about is how pain works. Say if you hurt your thumb doesn't hurt. It's your brain telling you that your thumb hurts. It's very interesting.
I think about my own experience as a kid. If I had have known the neuroscience that I know now, I think I would have been a better friend to kids who are struggling quietly, because the data shows there's a lot of them. Just knowing strategies like sitting alongside someone, being at their eye level, making eye contact, listening, like some of these really basic things that don't seem like health interventions, they're probably having health benefits.
Everybody in society carries some responsibility for not just ourselves, but also that we can help others. And understanding pain is the biggest part of helping others, because when we understand it, we can talk about it and we can help people take one step forward to improve their life.